Hello, this is Bob Browner with Community Coronavirus Update number 76. Today we'll talk about CDC Mask Confusion with the new announcements, the concepts of individual versus collective decisions, and a little bit about COVID risks for kids. And so, of course, there's been a lot of controversy last week. I agree that the CDC probably could have handled this a little better. But on top of that, I think the press actually was part of the problem in how they reported it, and they reported some things and not other things. And I think that's just generally confused everybody. And so the real answer is, do you have to wear a mask or not? It depends on whether you're vaccinated. And so, although it's true, and I do agree with the CDC on this, that if you're vaccinated, you don't have to wear a mask. But what kept being missed is if you're not vaccinated, you should still wear a mask, regardless of whether it's being enforced or not. You should wear one if you've not been vaccinated. And the question, of course, is, well, because there's different groups of us all in the same setting, how do you handle that? And that's why I think things are going to be really complicated the next few weeks and a lot of controversy, unfortunately. So I think it's helpful to kind of talk a little bit about the difference between individual versus group decisions. And so the analogy I'd like to use is, let's say I've got a Corvette, and that Corvette can easily go 150 miles an hour, probably pretty safely actually. And if I had a meeting in Grand Island, I could be there in under an hour because that's a really straight interstate. So in theory, I could drive that thing 150 miles an hour and get to Grand Island to my meeting in under an hour. However, just because I individually might have that Corvette, I don't. But if I did, I could do that. The reality is I can't because this isn't a individual decision. This is a group decision. The reality, of course, is you can't drive your Corvette 150 miles an hour down the interstate to go to Grand Island. Because there's a lot of traffic. Some of you know there's a lot of truck traffic. That who knows when they're going to make this a three-laner. So right now, from a safety perspective, even though I could go 150 miles an hour, really the speed limit needs to be 40 to 75. Maybe 80, 80 plus, to be honest. But yeah, within reason, unfortunately. And of course, so essentially, just because you as an individual can do something doesn't mean you get to do it in every situation, because a lot of environments are collective environments, like driving down the interstate. And what I think keeps getting lost is it doesn't apply in all times. So even the mask recommendation of CDC says those don't apply in all settings, like being on an airplane, for example. Just like speed limits, it's not 75 everywhere. It might be 25 in a school zone, for example, and that's very appropriate because we're going to talk about all these implications for schools here in just a little bit. And so the same things kind of apply. There's kind of what you could do as an individual. However, since we live in society with other people and we have to be cognizant of their needs as well, just because you as an individual might be okay to do something doesn't mean you can do it in every circumstance. So the other challenge we have is that our public health decision making in the United States is very decentralized, unlike other countries. So the CDC at the national level can set recommendations, but they can't enforce much actually. Those duties are deferred down to the state, and each state, depending on how it's set up, this could be either a state or a local decision, or if you're in Nebraska, it actually depends where you live in Nebraska. So if you're in Lincoln, that's a local decision through the Lincoln-Lancaster County Health Department because of a quirk in our law, whereas the rest of the state, your local health department can and has been overruled by the state, so it's not a local decision. The state does not let public health decision making be made at the local level except in Lincoln, which is odd, of course, and that confuses everybody too. Both the state and local have now bowed out and they're not going to enforce mask ordinances in Nebraska. So now it's no longer an enforcement issue at any of those three levels. It's going to be more as an organizational and or individual decision, which gets complicated because those are very different environments. They're complicated, and frankly, there just hasn't been a lot of guidance in those situations, which makes it very difficult for people who are at a business or a school or anything else. So how do you figure that out? The one thing is trying to create what's your barometer of normal, and that's yet another problem. So, with speed limits, we know they're in miles per hour, but the way things are being set, everybody's color schemes are different. So the state set its color scheme not based on risk, but hospitalization rate. The city set its risk on a different proprietary method. And so we have no common language for saying what's risky or not from a color scheming. Color scheming is to make it simpler, but unfortunately it's make it more complicated because nobody's been able to come to a common agreement on which color scheme means what. Over the last however many episodes, I've used mostly the Harvard SAFRA criteria. So if you go to sites like COVID Act Now, they have logos from Harvard and Stanford because that's the general public health one, is this threshold. However, there's now a new threshold that was put out by the CDC for guidance to schools. They're pretty close actually, but they're not identical. And so which of these risk levels will you use? Yes, Lincoln and the state have their own color scheme that isn't comparable, which is confusing to everybody. But I've used for the community level risk the Harvard SAFRA criteria for both this slide and also the one that looks at the state view. And then when I talk about schools, I'll use the current CDC guideline, but that'll probably be updated the next few weeks. So for example, Douglas Sarpy, if you use the Harvard SAFRA criteria, would be in the yellow area. What's different about us in COVID Act Now only gives you the county. We've created the healthynebraska.org Tableau site so you can combine counties. Because if you're in Omaha, metro area combines both Douglas and Sarpy County, but they have two separate counties, two different public health districts. So you'd have to go to both sites. This allows you to merge them together, and so this might give you at least a different way of looking at community level. For the school level, for what I'll probably be looking at wearing my school board hat, I'll look at the CDC thresholds. The good news in Lincoln is our numbers really are dropping quite a bit, almost to this really low risk category. Fingers crossed, we may actually get there, and that makes our decision making for the schools much easier as we get closer to summer school and having kids come back in the fall. But we do need some common language of comparison, and so I'll probably be using this for the time being, unless the CDC updates their school level risk thresholds. And so, here in Lincoln, the mayor did announce green, but it's a different criteria than the CDC school thresholds, which don't have a green, and that's the reason they deleted the green, just to point out that a lot of what's being used at local and state levels isn't comparable. But I would highlight that the mayor did point out that there is a list of full recommendations regarding masks that, again, echo what I said before. If you are not vaccinated, you are still supposed to be wearing masks in many of these environments. The city's not going to enforce it yet. However, the businesses may enforce it. And so for what I've done, for example, in my office, I have told my staff that you must wear a mask unless you've been vaccinated, and I expect you to show me your vaccine card. And that will be the decision about whether in my office you can get by without wearing a mask or not. But what do you do someplace else? So the short version again, mask versus no mask. If you're vaccinated, you don't have to most of the time. And if you're not vaccinated and you're inside, you should still wear a mask. Outdoors doesn't apply very much, for example, but indoors this does apply. So what about where you might go? And this is where things get complicated. So yesterday I had a meeting at a coffee shop with our maternal child health group, which is a bunch of physicians. We're all vaccinated. So for us, it was pretty easy because one, A, all of us have been vaccinated. B, I actually happen to know some of the people in the coffee shop. It's a neighborhood coffee shop. Based on the demographics and those people, I'm pretty sure that that coffee shop was 90+% vaccinated. So we actually didn't wear a mask in that coffee shop meeting yesterday. On the other hand, churches are a really complicated session because right now there's really not a lot of guidance available to those churches. And I had this discussion honestly with my own church at a 7 a.m. Zoom meeting this morning. They're trying to sort of move their way through this. The thing about a church is a church serves all age groups. Many of those age groups can't even get vaccinated yet. So by definition, some of those people won't be vaccinated. Well, how do you handle a group setting where some are vaccinated, some are not vaccinated? My general belief is that if we're a welcoming church, we should welcome all age groups, all families, kids in the age that can't be vaccinated, and some parishioners who, for example, may have health conditions such that maybe they got a vaccine, but their vaccine doesn't work because they have immunocompromised systems. Well, to be a welcoming church, I think you should create an environment where you're not potentially making some of your parishioners hospitalized or dead. That wouldn't be very welcoming. So in a church right now, I would encourage us to wear masks until we know that a higher portion of the population is vaccinated, and so that all age groups have an opportunity to be vaccinated, which we're not there yet. So my recommendation is most churches should still be wearing masks because of that. If you're going to be a welcoming church, you shouldn't make your people sick or die potentially. Another big question that I keep getting, giving my school board hat, is will kids have to wear masks in school in August? And the answer is we don't know yet. It's not realistic to even ask that question yet. Asking us that question would be like asking Coach Frost, what play you're going to call next week, the first play of the third quarter. And Coach Frost is going to say, I don't know. I can't tell you what play I'm going to call because I don't know. Will I be 1st and 10? Will I be 2nd and short? Will I be 3rd and long? Will it be on the 50-yard line? Will it be on the red zone? Will it be raining and windy? All those things are going to play into that factor. So he can't tell you what play he's going to call the first play of the third quarter, just like the schools can't tell you, will we be wearing masks in August? There's a lot of things that have to happen over the next couple of months before that decision can be made. There's some criteria, of course, we would use, like, for example, what is our community vaccination rates? And with the recent addition of 12 to 15-year-olds, that's going to get better, of course. It's going to depend on rates of community spread, which thankfully are getting much better, at least in Lincoln, but not uniformly across the state now. Some areas of the state are going back up again. And also there may be some measures of even building level spread. So Omaha, you may have heard, did some wastewater sampling. So in theory, you could basically test the wastewater of all the elementary schools and say, you know what, we're testing and there's no coronavirus in the wastewater, therefore there's no coronavirus spread in that school, therefore they don't need a mask. On the other hand, maybe it turns positive yesterday, okay, everybody put their mask back on. And so we could create levels like that. And that's the kind of stuff that I hope the CDC will be helping us with in the next few months, that we can decide and have a safe, orderly way of starting school this next year as opposed to this year, which was a mad scramble. The good news is our community vaccination rates, at least here in Lincoln, are really good, and so the public health department does have this really nice visual of who's got at least one shot, who's got fully vaccinated, and actually we're almost 11% just with less than a week of vaccinating those 12 to 15-year-olds. So I could easily see us getting to the point where the 12 to 18-year-olds in middle and high school could be at 70-80%, in which case maybe they won't need to wear masks because we have a good enough vaccination rate. On the other hand, though, what about elementary schools? We don't know that yet, of course. The other thing is that people, some of this is an individual enforcement mechanism. So I will ask my employees about their vaccination status, and I can do that. Your local epidemiologist Facebook page, she did a great job of explaining this. That people, there's a lot of misconceptions about what HIPAA really says and doesn't say. HIPAA doesn't say your employer can't ask you that. HIPAA says that your employer can't ask your doctor that question, but they can ask you that question. Now the other thing is you don't have to answer that question, but you have to bear the cost of not answering that question. Such as not being able to enter your workplace or board a plane. So if I, as an employer, ask you that question, you refuse to answer that question, I can say then, okay, if you're not going to tell me your vaccination status, you have to either A, wear a mask or not work here. And if you say, I don't want to wear a mask either, then I can fire you. And that's probably what I would do, actually. So HIPAA does not protect you from your employer from asking that question. So that's a common misnomer out there. So, getting it wrong versus getting it right like last week. We could follow the path of Israel and UK, but I don't think we're going to because we need to do what they did, which is to have vaccine verification systems in place, which we don't have. It's all going to potentially be on the honor system, and I don't know if that's going to work very well. So what I suspect is we'll see is the sporadic regional outbreaks this summer. Some will follow the science and data, and some will follow their ideology and wishful thinking. But there is still a concern of the new variants, and would we start over again? I think it's unlikely, but it could be a problem. So, for example, again, the B117 is now half of spread in Nebraska, and that is pretty infectious. The good news is our vaccines work against it. There's also the India variant that is proving to be very infectious in India, and it's already here. It's in almost every state in the United States, and we've already had the first case in Nebraska. So you see that 1 out of 1,461. So they did see one of those Indian B1617.2 variants. So far, we know that one's much more infectious. We're not sure whether it's more severe, but the good news, it looks like the Pfizer and Moderna vaccine would work against it, for example. So fingers crossed that our vaccinations are still going to work against this new strain. So lastly, we talk about risk for kids, and so this is also a common misconception. Although the kids are at lower risk, they still are at risk. It's just not as high as adults. For a long time, we were saying that, yes, there's some risk for coronavirus, but it's no worse for an influenza. However, that is now no longer the case. So as we were following this, and this was presented last week in the CDC update, it looked like our COVID hospitalization rates were pretty close to influenza, but they've actually exceeded that. And keep in mind, they've exceeded that even with all the interventions we've put in place. So all the masking and cohorting and all the stuff we've done still has not kept it. And so even in children, we now know that coronavirus is more severe than influenza. It's not as bad as the adult population, but it is still worse. And so we're not in the clear. You can't just let it run rampant amongst kids. And so with this, even in Nebraska, we've had 126 hospitalizations of kids and 4 deaths. And keep in mind, that was with everything we did. So had we not had kids wear masks in school and done the other things we did, there would have been a lot more hospitalizations and a lot more deaths. So if we're going to remove that, we have to realize if this is an unvaccinated group, it would spread like wildfire amongst those kids and cause more hospitalizations and deaths. The other problem is that one of the severe things that they get, the multi-inflammatory syndrome, the median age for that is 9, which is elementary school, which is the exact group we don't have a vaccine yet. Most people are hoping we'll have vaccines for that age group probably in the September-October range, which means come August on our elementary schools, we may need to still have the kids wear masks depending on rates of community spread. So there is risk, so it is not a no-risk environment, and we have to be cognizant of that. And again, one of the things for vaccination rate, we got to work on this vaccine campaign to get as many people vaccinated as possible. On the CDC side, people want to get their vaccine at their doctor's office, but that still isn't happening for the most part in Nebraska yet. So fingers crossed we'll get there. The other thing is there's just a lot of mistrust of the government right now. So we're going to do a lot of our advertising in the future non-governmental. So it's going to be direct messages from people who take care of you. So here's our advertising campaign we'll be launching soon with, Buffy Lewis Hunt from Bluestem and Dr. Horacio Alvarez Ramirez from Bluestem, trying to carry the message straight to people. Others across the state, like Mel St. Germain, the medical director of Children's Physicians, also put out this 2-minute YouTube explanation of what's going on. And we're not just going to use medical professionals, but some other trusted voices in the community. people like Gerardo Meza, who's a musician and teacher, or Pastor Renee Massey, who's a minister. Hopefully those will be some trusted voices that people will listen to, because this isn't the government. These are people hopefully you trust, your own doctor, your own nurse, your friends and prominent people and clergy in the community. People putting out better information. But again, things are looking good. Get out there, be outside. It's safe regardless of vaccination for the most part. Outside where you don't need a mask, but be cognizant inside and use your risks in these various different thresholds to set your own risk. So hopefully this is helpful to you. Again, past episodes on healthylincoln.org. Disclaimer, these are my opinions, not necessarily places who I work with and for. But again, hopefully this helps.